All right, so I'm going to go ahead and review the agenda. A little different today. This is our first time being with everyone completely virtual, given the rollback. So I will be monitoring my screen to see if there are questions, and you can always wave or do something. So if I don't see you. See your question pop up. So on the agenda today, we'll start off with Steve giving us our dashboard update. Then I want to give our interim health officer, Dr. Velasquez, a minute to talk, to give you some feedback and some impressions of what's happening here at the health district. He's been with us now for 2 weeks. I've got Lindia, our incident commander, queued up. She's going to provide an update on testing because we do have some community testing that's getting ready to come on board. I've got Kelly for communications update. GSI, I've still got you on here. I know you were out last week. But you're up today. And then also on the line that I've invited into these meetings, because we've been getting more questions related to hospital capacity, is our Ready Coalition manager. His name's Casey. And so this is his first meeting. So he's not prepared to present, but he is on here in case we have questions. And then at our next meeting next week, he can provide an update just like everyone else is providing. So does anyone have any additions or things that you want to make sure we add today? All right, well then I will segue over to Steve for the dashboards.
All right, good morning, everyone. So going through the data from the past week, between November 15th and the 21st, we had 1,672 new reported cases. That puts our daily average up to about 239. The prior week, we were looking at about 214. The 2-week total now is at 3,100, so 3,164 cases. The prior week, 2-week total was about 500 less at 2,500. Age groups we're seeing still consistently across the board of being kind of working age adults. Those between the ages of 20 and 29 are about 24% of new cases, 30 to 39, 17%, 40, 49, 15, 50 to 59, 13%. So definitely within that working age group. Our rate per 100,000 during the past 2 weeks between 11:15 or between 11:1 and 21, we're looking at more like 614. Currently, after yesterday's high reporting number, we're closer to 700 per 100,000. In the prior week, there were 62 new Spokane County residents hospitalized. There were 55 the week before that. Currently hospitalized in Spokane County, there are 111, and 104 of those are Spokane County residents. Unfortunately, we did have 9 people pass away last week, including our youngest at this point, an individual between the age of 10 and 19, 1 individual in their 50s, 2 in their 60s, 1 in their 70s, 3 in their 80s, 1 in their 90s. Testing, we continue to do more testing, but positivity rate is up. The average number of tests daily last week were at about 247. That's up from 218. But our positivity rate is 19.1%. That's up from 16%. For healthcare system readiness, the current percent of licensed bed occupied by patients is 59.2%. The total number of staffed licensed beds, which is a new way we're looking at it, is about 1,353. Licensed beds occupied by suspected and confirmed cases are 111, and 7.6% of licensed beds occupied are COVID positive patients. For case and contact metrics, we investigated in-house 1,117 cases the previous week. We reached 70% of those within 24 hours. Care coordination, we continue to work with families and households in need. To date, they have seen 1,071 households. They currently have 170 open cases. They closed 110 last week. Trends for service continue to be PPE and cleaning supplies, food, and financial assistance. Our business technical advisors also continue to work with the business community for support and guidance. To date, they have done 3,149 consultations. In the past week, they did 258, which was an increase from 208, which is just over 3,000 that they completed referrals to. Food security, there have been an increase in EBT applications from the prior week. We're up to about 732 per week. That's up by about 100. Childcare maintains the same as far as vacancies. And then for unemployment insurance claims, there was 1,107 between November 8th and 14th. The industries impacted most in the latest reporting were specialty trade contractors, food services, and drinking places. All else are pretty minimal compared. And then finally, for high-risk populations, the number of outbreaks in long-term care facilities, there were currently 58 altogether in Spokane County long-term care facilities. 28 of those are considered an active outbreak status, which is 4 new facilities over the past week. And that concludes my reporting for the moment. If anybody has any questions, happy to answer.
Okay, no questions for Steve. Oh, Todd.
So with this surge that's come in the last week, I know before we were talking about these are social gatherings in homes that seem to be building our numbers. I mean, this is a big surge in 1 week. So what are you, at this point, attributing the majority of the cases to?
I'll let Dr. Velasquez also put some input in this, but going with the same, it is gatherings at home, but then people go from their homes to their places of work, and the transition we're definitely seeing within places of work as well.
And I think Lindia may touch on this some, but I think from the health district perspective, Todd, it's just completely in the community. It's community spread, right? So, I mean, we do have a couple of incidents, like Steve mentioned, in long-term care facilities. But at this point, it's everywhere. So it's not like there's one specific place or one small outbreak. It's just kind of everywhere. And I think Dr. Velasquez was maybe having issues with his camera.
That's correct.
Okay. Are you there now?
Yes, I'm here. So good morning, everybody. And I figure you did not want to look at the parking lot for the rest of the day. And so I had to shut my camera off because for some reason it's looking out and not in, and we couldn't figure it out. So my apologies for that. I'm sure we'll figure out for the next time. But I wanted to, first of all, say thank you to all that I have been in contact over the last, I'm entering my second week, and I think I've spoken with most of the people that I see on the screen. So I appreciate that. I just wanted to comment on Steve and Amelia's statements about the infection rates and the cases, including basically all areas of the community. And if you look at the breakdown, everything from retail, transportation, other services, et cetera, it is a pretty accurate statement. I think we're seeing cases all throughout the community, which is one of the concerns we have, particularly when we look at schools, for example, where the transmission inside the school may be very low, but as teachers, parents, staff, and others interact in the community, the likelihood that it will get into the schools is higher. And we're seeing a little bit of that with many of our K through 12, although most of the students we have are K through 2 in most of our schools. But I wanted to move from that for a second and just try to put into perspective, I think, what we're seeing. And what we're seeing is an increase that in some ways was predicted or predictable, because we knew based on the trends that we will see an increased number of cases by about now, which is one of the reasons why the governor move forward with some of the rollbacks, because whatever we're seeing today didn't happen yesterday. Actually, it's been in the works for the last 2 weeks or so in terms of community spread. So the reason why I bring that up is because the benefit of some of the measurements that are in place now, which I know are complicated and very difficult, particularly as we look at the Thanksgiving holiday, we won't see the benefit of that for basically a couple of weeks, just because if you think about the incubation period and the time to symptoms and so on and so forth, it takes a few days for us to go from being contaminated from another individual to either developing symptoms or testing positive. So I think we have a little bit of work to do. The goal is to flatten the curve a little bit with the measurements that we have in place. And as we have seen in areas such as long-term care, some of you may have listened to the news we had last week, which highlighted people in long-term care between the ages of 80 and 90, which back in the summer were at the highest rate for not only hospitalization, but also morbidity and mortality. We managed to decrease that by almost 50% from July to November, thanks to the work of our long-term caregivers and all of the measurements that have been put in place to prevent the spread. So we do know these things work, although they're difficult and keeps us apart from the people that we would like to share time with. So I've been here for almost 2 weeks, and I have a couple of observations for the team that is at the table. First of all, like I said, I've connected with many of you, and I do appreciate your support. And we're in active conversations with everything from elected officials to higher education and everything in between. And we spent a great hour yesterday with our friends from the hotels and the convention industry, trying to determine how best we can help going forward. And we're doing that with all of the segments of industry in the community, because our goal is to be helpful. And my observation is we have about 300 employees at the health district. I've managed to interact with most of the teams that are active in the community. And I have to tell you, we have a large number of very professional, extremely committed, experienced individuals here who are the ones that keep things moving. I just kind of like joined the team in movement. And I think we as a community should be grateful that we have that large team here, and should be confident that they are and have and will continue to deliver all the services and support that we need. So at this point in time, we're very actively providing as much support and guidance to all of the segments of the community to the best of our ability, and following the numbers very closely because of the outbreaks that we're seeing in pretty much all areas. So I'm going to stop here and see if anybody has any questions for me. And when Zoom, you usually wait the 10 seconds politely, and if no one raises their hand, we'll assume there are no questions. Oh, Kara, I see a hand.
Yeah,
Kara,
so I put this in the chat. Hi,
Yep,
I
and
put it in the chat.
I was going to have Lindia touch on that, Kara, because I think
Great.
she'll have a better, she has the most information about that topic.
Great, perfect.
Good question, Lindia.
Yeah, yep. I will cover that in my report.
Okay, I don't know what that is, but I'm sure Lydia will cover it. So I just wanted to make one final point, because there are a lot of conversations in the community around testing. And we have started a program for antigen testing in high-risk areas, which is going very well. It allows us to do almost immediate disposition of cases, which I think is important. And the reason why I bring that up is because we all have had this discussion over the last few months that at some point we should get into an environment where more rapid deployable testing becomes a tool that is used in particular areas. So last week, we actually started to do that using the Pinax test from Abbott for the most part, and with very good results. So I will be reporting on that in the future as we gather some data and really measure the impact of rapid testing. And I think as a community, we're going to have this conversation going forward a couple of times as we look at areas in which this type of testing can be applied. So with that, I'm going to stop, and if there are no questions, I'll mute myself.
Hey, Amelia, this is a question probably for maybe for Frank, but just in general, as you're meeting with the industry sectors now and as we move forward, it'd be really helpful to see if there's some, like, thematically, are there some consistencies of things that are coming out, or the kind of as advice as far as where we're landing? I mean, those kinds of things that they can filter out, because I think there's lots of layers of discussion and advocacy going on with sectors. And the more we're able to at least kind of connect some of the takeaways of that will help us be consistent in our advocacy to our elected officials or to any of the others as we're trying to think about how we support these broad sectors. So kind of more of an ask as we think forward on that.
Yeah. So one of the things that we talked about last week and that we've kind of been, putting together, I actually asked folks for some feedback on potential like PSAs or like information that we can put out. And, we've been getting a lot, our business technical advisors with the new rollbacks, they've been really busy. And, that email that business owners or, business managers can email their questions to, we have someone monitoring that for triaging. And one of the things I talked with Kelly about, and that we've put on, one of our communication kind of updates, is just really, and I think we're going to talk with GSI about it, is having kind of like a little snippet or a video that just shows people where to go from the different industries for the guidance that is sector specific. So that's one thing, because we know that like when people call in, they're looking all over for the right information. So we were thinking, kind of like here's where you click, within the different websites. But I can circle back to our business technical advisors and see if there's anything beyond just needing to know where to find the guidance.
Yeah, maybe Ray or Julie could report next time.
Okay. Yeah, that's good.
So if I could make a comment, Alicia, something I think is very important that I think Amelia alluded to. So we all know that there's some limitations to what we can do right now because of the rollbacks. But one of the areas that we're focused here, particularly as we talk to businesses and industry segments, is not on, we all know what we cannot do, but what we're trying to do is help them with what they can do, what can be done. And we've had some success, like with the virtual gala for the symphony and a number of other things that we're trying to be helpful, applying the expertise here, still meeting the guidelines, but allowing organizations to bring some activities to the community. So I think if there are any questions, we're here, and I think that's a message. We all are aware of the fact of what are the limitations that we have, but let's look at the activities that we're looking at and see if there are ways to deliver some of that either in a restricted way, or in a virtual way, or a hybrid way, which we've done with a couple of organizations. That's kind of like the message. And we've been very successful with a variety of things. Well, the team here has been very successful, and we do that. We do that every day. So it's something to keep in mind. Thanks, Amelia.
Yep.
Thank
Go ahead, Linda. Mm-hmm.
So Dr. Velasquez almost stole my thunder. I wanted actually to start out with a positive. We did get about 11,000 Binax Now point of care tests, and those are an antigen rapid test that we can use in some of these outbreak settings. And this last Friday, we hosted a testing marathon at the House of Charity that had an outbreak. And we tested 80 different people with 7 positives. And why that's meaningful is we can immediately remove those positives from the shelter and get them into isolation. Then we did additional 35 people on Sunday and found 2 more positives. So we're going to continue that like every other day, testing at the large shelters to really try to control those outbreaks. We were very fortunate that we didn't have any outbreaks in the shelters up through November. And I think we really have to credit the shelter operators and the individuals that really complied with the guidance. But we knew as the winter came along that people would start coming indoors and we would have outbreaks. So I just want to give kudos to the mobile triage testing team at the health district here. We use Medical Reserve Corps volunteers, the House of Charity staff, and the City of Spokane staff that really supported that. And we're going to continue that going forward. So that was my big success for the week. And we do also have lots of challenges. So just as the question in the chat box around cases and contacts. With the explosion of cases, we really have to prioritize. And so we've been talking to the state about kind of a quality improvement of how we focus our time, and we really look at the cases and the contacts that could be most impactful. And so it's really looking at the highest risk and the highest risk settings and focusing our work in those areas. So there's lots of research that's coming out, and the Centers for Disease Control I saw just came out today with very similar guidance to what we've been talking to the state about. About 10% of people are impacting about 80% of new cases. So if we can focus on that 10% and figure out where they got it and prevent them from further spread, we should be able to control the outbreaks better. So this is the congregate settings, the jails, the treatment centers, the homeless shelters, behavioral health facilities, long-term care, adult health homes, the large manufacturing facilities, unsanctioned large events and gatherings, and really focusing our energy on those type of settings. The individuals that don't receive their lab reports back for 7-8 days, it's pretty much too late to then contact them and find out their contacts. So spending less energy on that and more on these high-risk settings. They will still be contacted, they still will be reached, but we won't be spending as much time on those cases and contacts as in the other areas. So our whole theme those last couple of weeks is on quality improvement and really figuring out how to best focus our time and have the greatest impact. So I'll talk a little bit about that kind of throughout my talking points. So our testing capacity right now is very focused on these high-risk settings, uninsured, vulnerable populations, high-risk populations. We have staff assigned to outbreaks, such as in the long-term care and congregate sites, and they work very closely with those sectors. We really have to rely on each agency and organization to kind of take on this and work with us, because we just don't have that capacity to do all of the work. So we provide testing supplies to these facilities, and then they start using the tests. We'll continue this aggressive approach in the shelters, and we are using some of our medical case management staff now and getting them trained up that will be rotating through the shelters to continue this every other day testing. We also need to train shelter staff and get them so that they can actually test on intake when people are coming in the door. And again, that will help us expand our ability to manage those outbreaks. So along with the needed transportation that I talked a little bit about last week, we have really identified that we need kind of a dispatcher, someone that can really take a triage work between the triage people, the shelters, the isolation facilities, knows where the bed capacity is at, and help transport those individuals when they're identified in the shelters. So I know Sarah and I will be talking later more about that. We are looking at if we fill up our isolation facilities, how else we can expand out, and more shelter space would be really helpful just so that we can help space residents out. The Ready Healthcare Coalition has been holding coordination calls on community testing, and the volume of testing in our community has grown, and it'll continue to grow. But we really are dependent on the healthcare system to do that testing. So we have been holding these calls, and Chaz, who is a great partner, is really stepping in and taking on a community testing site in the community. It'll open up early December. Providence and Multicare, WSU are all a part of those discussions, and we'll be supporting Chaz. But they plan to be at the arena about 7 days a week, and it would be open to anyone. So we're monitoring the school situation, and we're starting to see more and more cases. So we're going to have to really watch that. But we are really trying to empower the schools to manage their cases and their quarantine and isolation guidance. So we'll just kind of continue our discussions with them and making sure that they're on top of what's happening in their schools. And then with the healthcare capacity concerns, we have been meeting with hospital leadership, and the Healthcare Coalition has been coordinating calls. The hospitals really are looking at some staffing requests through the Department of Emergency Management, patient placement across the region and how they can do that, crisis standards of care, offloading some of their low acuity patients to other sites. But again, there's kind of a staffing need if they do that, reducing non-essential surgeries, and their last option with our support is an alternative care facility. We really are trying to encourage them to see that as a last resort and not jump to that conclusion, as they're very hard to stand up, they're very hard to staff, and patient care is not as good as if they were in the hospital or their own setting. So those conversations will continue. And then just last, we have some serious staff burnout and exhaustion happening in our agency. And I just hope that everybody can give us grace, that if we don't communicate as well as we should, or, we're imploding a little bit. And I just want to kind of reiterate what Dr. Velazquez said. They're very passionate staff. They're working their heart out. And sometimes it's hard to hear criticism from the community and things that are going on in the community and feeling like we're kind of being put on the spot. So just wanted to say that they're really good people that's working hard here. Any questions?
Thank you, Linda. Very, very good point. I know we're all a little, not a little, a lot concerned about staff. There was a comment about capacity at the isolation facilities. Do you know our numbers today?
I don't. Steve, I don't know if he had a chance to find those out.
Unfortunately, I haven't received any yet.
You're very jumbled, Steve. I know that we're not, I have not heard that.
No.
Yeah.
So isolation, people at the isolation facilities, it's kind of like an accordion. There's lots of people, then there's little people, lots of people, little people. So it's kind of a rolling capacity issue. And we've been running around 40 to 50 between the two, and I don't know if that's increased over the last couple of days.
We also have a lead on potentially another space if we need to pursue that, that Dr. Velasquez and I are going to follow up on. Any other questions for Lindia?
Okay, thank you.
Thanks. Okay, Kelly, I think you're on here. Communicate, there we go. All right.
Hey, everyone. Yes, in communications world, there are some areas that we're primarily focused on, and those are messaging around the growing concerns over the gatherings that we're seeing, also mental wellness within our community, and also working with DOH on communication around vaccines and where we're going with vaccines. So those are some focuses. Even our Facebook Live last week was part of that strategy. Yes, we talked about the successes we've had with long-term care facilities, but also gave that really important message of if you're planning on bringing your loved one home, can you reconsider that? Because it's not, yes, it's the holidays and we are used to gathering and that's a time of togetherness. But this year we need to reconsider that and hopefully keep our loved ones safe. This week during Facebook Live, we are collaborating with our hospital systems to further explain how we feel about how this is going to affect our hospitals. And as we see these spikes today, what that's going to look like 2 weeks down the road or 3 weeks down the road. And just remind people how important it is as you're planning your Thanksgiving or your Christmas to not plan for a large gathering and how that's going to affect our entire community. So that is the plan for those. We are also, our young adult campaign continues. We did have to postpone our third series of videos with Gonzaga just because of recent events, which got us into basketball season. So now it's just a little bit trickier to get our star power, but we're looking at filming those the first week of December. Hopefully, our fingers are crossed that works, but they're very, as they should be, keeping the activities that their athletes are doing pretty tight to keep them healthy as well. So all of that is being discussed and we care about that as too. So with the vaccine messaging campaign with DOH, we talk to them weekly on how that's going. If you haven't seen the ads, then I'm not sure what you're listening to because they're currently saturating all of Washington Market. Their goal is to reach 90% of residents throughout Washington state with their ads. Right now we're in phase 1, which is about preparation, about giving knowledge, the why behind the vaccine, and chip away at any misinformation that is out there. So that's where we're at right now. There's a lot of information we're preparing to share, but that we don't have. So we're not completely there on how much vaccine we're going to be getting or how that's going to be distributed everywhere. And as the phases continue throughout the vaccine messaging, it'll become more and more localized as we know what it is that our team is doing. And they're working right now a lot on getting all of that set up as well. What else do I want to talk to you guys about? Another important thing that we're doing is supporting some of what Lindia talked about and making sure that information is easy to find for people if they do test positive or they're going in to get testing. What do they need to do? So they have that information on hand and they're not waiting for a phone call before they make a decision to not be around people or make a decision about isolating. They know where that information is. It's easy to find on our website. It's all there right now, but right now the guidance has been you get tested and then you get a call from the health district and they tell you what to do. So we need to change that messaging to you think that you're positive or you did get a positive result, here's what you need to do, so that they're not waiting for someone to tell them, that they have those tools readily available to them. So that is something else that is a priority for us right now. Over the past week, if you didn't see it, and I wasn't here last week when you guys talked, but we had a wonderful story on KXLY about our community health workers. And so if you get a chance to watch that, it was a nice positive story of the work that's going on that I think Lindia and Amelia both referred to, and Dr. Velasquez, about the great things that are happening with our staff. So more and more, something that Frank and I are trying to talk about is every time we share messaging, what is something positive we can talk about? What is something great? What is achievement that our staff has made, to remind people that and you've probably seen this in my quotes and things, there are 300 people here and they're doing amazing work right now. And we want to highlight that. And also, in a positive note, I know that you guys talked about, and it was funny because Kara can attest, we talked about a positive PSA or something of thanks, and then Amelia's like, everybody was talking about a PSA of some sort, and I said, oh my gosh, we're all on the same line. But we are talking about, and scheduled for next week, a message with some of our frontline workers giving a thank you message. I think it's really important that people see those that they relate to right now, with coming out of elections and everything else, the turmoil that's been going on, to see people that are on the front line really helping the community, giving a message of thanks. So our firemen, our EMT, our nurses, our public health workers, saying, hey, thank you for your patience. Thank you for your kindness, showing kindness by wearing your masks. And that would be a great message. I think I asked them to bring in representatives that are a little bit on the younger side, and we can incorporate that into our buys that we're doing digitally as well with our younger audience. So, but I think it would resonate actually with the whole population. So that is about to take place. So look for that. I think that's everything. Any questions?
Thank you, Kelly, and thank you, Arian. She's going to put the KXLY link in the meeting notes if you haven't seen it. It's a good story. All right, thank you. So it looks like GSI, you're up.
This is Ray. Somebody had asked the question about capacity for isolation.
Yeah.
And I just got the numbers. So right now we have 50 rooms at Immaculate. Currently all 50 rooms are full. We have 68 or 36 rooms capacity at my place, some of which have double capacity. And currently we have, just one sec, I got to pull that number back up. So we have 36 rooms at my place, some double capacity. We currently have 16 individuals out there. So we do have about 20 rooms out there plus double capacity on some of those.
Thank you. Thank you. Okay, GSI.
Good morning, everybody. Nice to see you. Just a kind of a few updates to add on to all the different environment going on. We are in the middle of the review for the Spokane County Hospitality Grant Program. A thank you to the commissioners who committed to make some additional dollars available if needed to support all of the eligible applicants. We had over 700 eligible submissions, and so we're in the process, the team now, of review of that and on target to begin awarding those funds to those sectors the week of December 7th. And those are kind of all, there's a number of hospitality NAICS codes that are included in that. So it will be really important, and the opportunity they could apply for up to $20,000 in grant funds, which has been more than some of the other programs out there. So really necessary relief at this moment in time for those sectors that are being most impacted. And then you have all heard that the governor first initially allocated $50 million in funds for relief, and now they've increased it to $135 million in funds for relief across the state for those sectors most impacted by the newest restrictions. 70 million of that will now be in some type of business grants. And we should know, hopefully by the middle of this week, they're even shooting for before Thanksgiving to have the details of that process out. It is looking like it'll be a single site state application process that then we'll all be working to push folks to, and then they'll be working with their ADO network across the state for the really allocation of those funds to the businesses throughout the region. So that will be coming fast. And I think for this group, just know that we'll work to make sure everybody has that information, as certainly they will from the state level, but really your help in making sure that these sectors that will continue to be impacted have the opportunity to access relief to get them through the beginning of 2021. And then the other thing I would just say is that we've continued with some of our state business organizations, AWB, the Washington Economic Development Association, and others, for continued advocacy to both the governor's office and then our congressional delegation for the need for additional relief funds and supports for our employer community and their workers as we move through the winter. So that will continue, like many of you are working on. And then I think the last thing I would just say is that we've got many partners, and I know, thanks to Mayor, she came out over the weekend with that recognition of Small Business Saturday all the way through December. We just have our businesses and employers and their workers need our support more than ever. So there's just a lot of work going on around the whole idea of eat local, shop local, buy local. And our biggest message is to continue to encourage people to be patient, but to be able to really seek their services from our businesses here in the community through the next month. So you'll continue to see messaging, not just from us, but from partners across the region around that, and some of the great work that's lifting up both how we can access them online through work like Lift Local INW, but then some of the work that DSP and others are doing around Small Business Saturday and getting folks into some of these retailers. They're open, just limited capacity. And so how do we help people access that? So those are the things that are keeping us busy through the end of the year in this space, but happy to answer questions, and we'll keep everybody apprised as things develop on additional relief funds that are available for folks to access.
One thing I would bring up, I know this is separate from, businesses and funding, but one thing that definitely keeps me up at night here at the health district is we have not heard yet of any extension for CARES funding past December 30th. And, when we look at, capacity numbers going up, all, regardless if that's at an isolation facility or any of the conversations we have to have with the hospital or ongoing testing, that is something that the health district is really concerned about, because we know that on December 30th, the CARES funding goes away, and what we have received from DOH, there's very little there for what we can spend, December 31st into 2021. I think we just have about 2.8 million. So that is, in the health district can't, lobby, but, we're definitely advocating for decisions to be made, about what that's going to look like for all of us, because we know that we're still going to have people December 31st that need help. Oh, Commissioner French.
Yes, thank you, Amelia. We did receive last week an email. Carrie received it indicating that there is a conversation. I think it's one of the senators in Alaska that is leading the effort to try and extend the CARES funding at least through the end of the first quarter of next year. And so the anticipation is that some decision will be made in the next 2 weeks with regard to that. So we're hopeful that happens. We certainly have had conversations with our federal delegation to encourage them that would be very much needed, especially with the spike that we're experiencing. So just kind of a heads up, there is current conversations going on. Hopefully now that the election has passed us, they'll actually get some work done. So just an update.
Yeah, thank you. And if there's anything in anyone's conversations with, the federal, at the federal level, the state level, or anything that the health district can help with providing data for, happy to do that. Anything else that we need to touch on?
I just want to give an update from the state.
Amelia?
Mm-hmm.
Go ahead, Sarah. I just had a question that I can ask later.
Okay, I just wanted to share with the group briefly that so here at the city, we're ramping up and having 2 times a week an internal meeting for city staff and including our council members and their staff, just to stay on top of anything we're working on COVID related and to pool ideas about how we can continue to support SRHD. I've come to, after talking to some of your staff, I completely understand you guys are, doing a lot of work and staff are burnt the heck out. So trying to find ways that we can lean in and support you and support some of the staff that are doing that work. So we'll be having those conversations and connecting with SRHD probably even more than just these Tuesday calls. These are important policy level calls, but really appreciate Lindia and Dr. Velasquez and everyone who's been so responsive to some of our urgent needs, especially with the shelters. So just wanted to let you know that we're leaning in. If we ever didn't, we're doing it even more now. So it's a two-way thing too. So Lindia reached out last week with a need and we're working through that. Please, we encourage that. I can't give everything, but I can do as much as I can, and so can our team.
Thank you. Thanks. Oh, Commissioner French.
Yes, I was on a phone call yesterday with a consultant out of Seattle, and she was sharing with us that there are 13 health districts in the state right now that are currently experiencing, as your staff indicated, burnout among staff and other leadership challenges and stuff, because this has been an exhausting experience and stuff. And so I just wanted to say to you and staff that they are not unique. We're experiencing this across the state, and that we very much appreciate. And I hope that you will share this with all of your staff, that the community appreciates all the hard work that they're doing on behalf of the community and stuff, and really appreciate Dr. Velasquez's leadership and yours, and helping us get through this. So while we don't feel your pain, we empathize and sympathize with you. Thank you.
Yeah, we appreciate that. And I always pass along these comments to staff. And I know Lindia does as well. Anytime we get positives, I always pass them on. So thank you. I want to make sure. So Arian, did you have a question?
Yeah, I just had a quick one, and I didn't know who would be the best one. I noticed that you said you're focusing on some innovative, creative ideas to do what you can in spite of what you can't. If anyone even has a napkin list of what those are, if they either want to send, I can include them in here, or we can post them either at GSI for people looking at what can I do, maybe doing some lessons learned from others.
Yeah, that's great, Arian. I think Dr. Velasquez and I talked about this, and it's kind of that carrot and stick conversation, right? This, instead of just being constant, it feels like we're always this downer of you can't. So let's try to think about some of the things we can do and kind of have that message of hope with it. So yeah, no, if anyone has ideas, that's, great. If you send them to Arian and we put them in the notes, or email me, any of those things. All right. Well, I am not seeing any more questions, and I'm not seeing anything in the chat. So our next meeting will be next Tuesday, which I don't know what day that is. The 1st.
Well, before we go, could I just could I say something?
Sure.
Apologize for interrupting. That's the problem with not having a camera. You can see my hand up. So I wanted to put a little bit of a positive outlook as we get into the complicated time during the pandemic. And the reason why I say that is because we do need to focus on the things that are better than they may have been in the past. Well, number one, we actually know a lot more about this virus than we did 6 months ago. 6 months ago, it was a total mystery. Now it isn't. And because of that, we do know that the public health policies that we have in place, all over the country in a variety of ways, do work, although they're boring to talk about, like, facial covering, hand washing, social distancing, but they do work. We have better therapeutics, including some of the newly released monoclonal antibody therapies. So we do expect that morbidity and mortality will decrease over time. We do have a lot of testing options that are coming on board that will allow us to have more deployable community-based testing, which I think will be a great option over the next few months. And then lastly, we have 3 vaccines in the horizon, all of which put together give us a lot of hope for the near future. We just have to get through the next couple of months that are going to be somewhat complicated, not just because of the pandemic, but because of the colder weather and also because this holiday season for most of us. But we will get through it. And with all of the lessons learned, we will do better. And something that hasn't changed in the community, I still see, neighbor helping neighbor, friend helping friend. And as long as we continue doing that, we will get through it. And I think we need to focus on that. So I'm thankful for all of that. So when we go to Thanksgiving, and I have to tell you, it's going to be a very small Thanksgiving for us. It's actually the smallest turkey I've ever cooked in my life. So I was a little bit traumatized by that because my wife always tells me, you cook for like 100 people, but it's just a bad habit. But we have tailored our Thanksgiving to the current reality, but we're still very grateful for everything we have, and we're still very grateful to be in this community, and we're still very grateful for all the things that are happening that will help us going forward. So I just wanted to end that, at least my comments on that note, because I do believe there's a lot for us to be not only grateful for, but looking forward to. And in all my messages, I try to emphasize that because human beings, we need hope, and there's a lot of it. So just wanted to end that with that message of hope for all of us. Thank you.
Well, that's a perfect wrap up for the meeting. So happy Thanksgiving, everyone, and look forward to seeing you all December 1st, and take care. Bye-bye.